Hello, and welcome back to 10 Minutes With. Today, I'm joined by Professor Emily Jones to discuss patient partnership in rare disease research. Thank you for joining me, Emily.
Thank you for having me.
So, can you introduce yourself to the people at home? Who are you, what do you do, and how are you involved in rare disease research?
Yeah, so I'm Professor Emily Jones. I am from both Birkbeck and from King's College London. And so we do a whole range of different research projects, but all with neurodivergent children and neurodivergent families and kids with genetic syndromes.
Mm-hmm. And can you explain to people at home, what is patient partnership? What does that term mean? And how does it specifically apply to a rare disease research context?
So it means working together with academics and industry, and also with people who are affected by rare diseases. And so the most important thing about it is to work in partnership from the beginning. So to both think together about what questions are important to ask, how we ask those questions, what the results mean, and then how we share the results of the research that we do.
And what are the benefits of patient partnership? Why would an academic who's looking to go about starting a new study be interested in involving patients right from the word go, as you were just saying?
So I think the benefits are huge. I think firstly, to make sure that what we're asking is aligned with what people want us to be asking.
Yeah.
And those things can be really different maybe to what we might have thought in the beginning.
Yeah.
So some of the work that we do in autism, for example, there was a lot of focus in the beginning on social differences, but actually what a lot of autistic people were telling us is that the sensory world is a significant challenge for them. And that was actually something that they were really passionate about us asking. And once we did start asking questions about that, actually the results we got were more meaningful and more impactful, I think, but then they were also more aligned with what the community wanted. And so in the case of kids or families or people with rare diseases, often because they're rare by definition, they're smaller groups of people, and so talking to them directly and working with them to find out what it is that those people particularly want is super important.
Yeah, of course. And as you're getting that feedback from the families, did that pivot the course of your research in maybe a way that you didn't expect, or did it just open up new avenues? Can you tell us a little bit more about that?
Yeah, I think many of those things. So for example, on the sensory side, we do a lot of work on looking at developmental trajectories, so what the earliest signs might be of developmental differences. And so we do a lot of work in rare genetic conditions where there might be really early differences in social processing or in interaction or on how children do at school. But when we started to talk to families and they started to tell us about all these sensory differences early and sleep differences early, and that those were actually massively impactful, we then started looking in some of our brain data to look at whether there were differences, and we started to see those too very early on. So we shifted from seeing the sort of more symptom level, so the way that we do diagnoses, looking for those in early infancy and not necessarily finding anything that clear, to actually seeing much clearer patterns when we looked at sensory differences or sleep differences. And so what the families told us was super meaningful in terms of helping us learn more about conditions and also what those children might need.
And I mean, that's really interesting because it's obviously opened up a new avenue of research. But have there ever been, or I presume there have been, were there any challenges in integrating patients along the way, maybe just where systems aren't built to include patients? And how did you go about, getting over those hurdles? So
I think there's a number of challenges. I think firstly, usually when we write a grant, so the way that scientific research often works is that we have to come up with a question, write a grant, and then we get money to ask that question. And so often what we can ask is partly determined by what funders want to fund, but also we don't necessarily have any resources for a project until we've essentially planned it all. And so it can be super difficult to include people who have lived experience because of course they need to be paid for their time.
Of course.
And if you don't have any resources until you get the grant, you can't do that until you've basically said what you're going to ask, and then you're kind of locked into a program. So one of the biggest challenges is finding better ways of helping people with lived experience input at the beginning part of that process. So that's one thing. The second thing is, of course, people don't all have one view, so different parts of communities will have different opinions about things, and it's very easy to kind of go to the part of the community that will tell you what you want to hear. So we need better ways of making sure that we can get a range of different viewpoints and try to work out kind of where things then might be consistent or where there might be important differences, but they're both paths to explore. And I think the third challenge is for families or for kids who have more profound communication challenges, often it's really hard for them to have their voices heard. And so finding better ways of understanding their experience and what their priorities are is something that we really need to keep pushing.
That's actually very interesting that you bring that up, because 70% of genetic rare diseases present in childhood, so a huge portion of the rare disease community are children. how does that bring about specific challenges, maybe that other researchers you just wouldn't think about, or where it's different to involving an adult?
So partly those children in general are massively underserved, and children's voices are massively underrecognised.
Yeah.
And so there's a lack of investment, both from governments but also from industry in earlier development. And it's particularly acute when it comes to rare diseases, because of course in terms of a market share and so on, that it's really challenging to attract the level of investment that we need to make real change.
Yeah.
And then of course, those children and those families are super impacted, and so they have limited time, they have limited energy. Having the space to be able to contribute is often really challenging. And when people are putting together research projects, often the sort of traditional way to do it is to have a focus group or interviews, and that all takes time, it takes resources, you have to know who to talk to. And of course, children who might have more significant communication challenges or challenging lives, they often then can't contribute themselves either. So I think it's the challenge is particularly acute for this group.
But it's so incredibly important that they are still heard. And I think your project has been a great example of how it can be done. There are ways out there. It's just, taking that extra time or that extra work to find the ways that they can be involved. You touched there a little bit on how there kind of needs to be a cultural shift around patient partnership in terms of research. What would be your call to EU policymakers who may be watching about what they can do to kind of start that seismic change in a cultural sense?
So I think to start with, making sure that patients and families and kids are involved in the design of the calls themselves. So the EU Parliament or politicians will decide that a certain amount of funding needs to go to somewhere. So we need to be involving families even in that step of the process. So where should the sort of large funding allocations go? And then they'll issue particular what are called calls, so particular sets of instructions for researchers as to what we should be applying to do. And we need to be involving patients in designing those calls, because often by the time researchers apply for them, there's a lot of constraints put in place already. And if families aren't involved in that process, then it may well be that the direction that's been set is not necessarily completely in line with their needs either. So I think for policymakers, a lot of it is about trying to talk with communities and researchers, but families, when they're setting those priorities for the budget and setting the sort of broader scale scientific priorities for the community.
I mean, I think this is what we keep coming back to time and time again, is that listen to the people who know and listen to them right from the start, because it's only if they're included right from the word go that the end result actually ends up serving them in the way that, we all want it to. We all have that same goal fundamentally, but it takes a little while to get there. And so for your fellow researchers, what would be your message to them? Any kind of key learnings that you've had from your personal experience, or just otherwise a plea of how they can be involved in that cultural shift?
So I think firstly, one of the things we've learned is that there needs to be a long process of trust building, because for a lot of families, they've had tons of experience of being ignored or being dismissed or having to go to multiple doctors. They don't necessarily have a high degree of trust in the community in general, because it hasn't always served them that well. And so when we've done work in partnership, it takes time, and it takes a lot of being humble, learning, listening, and recognizing where the scientific community has done things wrong, to get to the point where you can start to then constructively build something new. So I think being willing to put the time in to truly listening to people, listening to a range of different views, so not just sort of seeking out what you want to hear, and being ready to stop particular research directions, even if you think it's super important. I think that is particularly important too. And then I think making connections to organizations that can help bring people together, because I think you guys and other organizations that work with patients play a super important role, because you do have the trust of the community. And so working together so that we can do that in a way that is meaningful for everybody is important. And I think the other thing is, it's super important that we're all, as researchers, feeding back to show people in the community what we have listened to and what we've done in response. Because I think the other thing that people do sometimes is take loads of input and do something great, but then it never comes back again. And so it's hard for families to know, did what I said happen?
And presumably that will help build that trust that you were talking about as well, if that constant evidencing of what of the relationship that you've built is only going to serve everyone involved.
So showing that you're accountable, that so even if we make decisions, not everybody's going to want not everybody's going to support every decision because there's a range of different views, but being able to go back and be accountable for that and explain why we've made particular choices and then take feedback and then constantly adjust. I think that's super important.
No, I completely agree. And to the people at home who might be watching this, primarily patients, what would be your call to them if they're looking either to get involved in research or potentially they've had an opportunity but they're currently finding it a daunting and new task? What are the things that they can do to take those initial first steps, scary as they may seem?
Yeah, so I think there's lots of different ways in. So I think either talking with community organisations, patient organisations, charities, because they often have a really good sense of what research projects are running, where there are opportunities to get involved. And I think they can also help with that initial step of, what research is and what we're trying to do, and some of those things that can be really alien if you come from outside of the research community. And then often there'll be studies running in people's local areas. So local universities or hospitals will often have studies running. And often on their website, they'll have information where you can just start to kind of look at what might be out there and get a sense of what different things are happening. And then people are always happy to be emailed directly too. I mean, we're always super happy if people want to help contribute. And then there are lots of other ways too. So often some of the organizations will run surveys or things like that to try to get an understanding of people's priorities. And so there's other ways like that can be super useful in terms of participation.
And just for a completion as a layperson, those surveys and things like that, those open calls,
where
are the majority of those found? Are they on academic, portals, websites? Are there certain places where they're gathered together? Or is it those community links that are usually the best ways to find the ones that are relevant to you and your condition?
Yeah, I think that's a great question. I think it's probably a need in some ways that there is more collation of some of these things. I think often there is quite individual level, a particular research group will do something and they might advertise it on Instagram or Facebook, places like that, but there isn't always a sort of concerted effort. But there are some organisations in the UK, Welcome, for example, that do then collate together, or Autistica in the UK. So there are some organisations that will pull together different opportunities and have ways of advertising those to the community and so on. But I think, again, it's an area where there could be a lot of improvement.
Well, I think that's given us so much to think about, even just in that brief conversation there. So thank you so much.
Thank you.
You have been watching 10 Minutes with me, your host, Rhiannon Walls. Make sure to tune in next time.